Welcome back. It's time for every resident of the Niagara region to have their say in shaping the future of healthcare. The Ontario Medical Association launched a survey June 7th in order to gather recommendations for both the region and the province. Dr. Richard Tytus joins the source. Dr. Tytus, it's early, but so far, how has the response rate been for the survey?
The response rate has been amazing. This is an opportunity for people to say, hey, besides COVID-19, besides the pandemic, what should our priorities be? So we've got over 1,000 people have responded already.
That's amazing. Do you feel that because of the pandemic, we're thinking more and more about how our healthcare system works?
Absolutely. And the fact is, during the pandemic, one of the untoward effects is, hey, we haven't been getting these tests done. We haven't been seeing our doctors. There's a backlog of surgery. They're saying like 3 years backlog. There's 250,000 Ontarians waiting for surgery.
Will this force big changes to the government, the results of this survey?
Well, the government needs to know. The OMA wants to know, but the government needs to know what's our priorities in terms of our priorities, the people of Niagara, the people of Ontario. And so by doing the survey, we get to point out, is it mental health? Is it addiction? Is it senior care? Is it access to more doctors? Is it virtual medicine? Where do we have to focus moving forward? And the survey is going to be released to all the politicians.
Beyond the survey itself, consultation with medical professionals, is that happening alongside at the same time?
Absolutely. So there's two parallel paths that we want to hear from everyone in Ontario, all the citizens. Hey, where do you think the priorities should be moving forward? But we also need to hear from the doctors that are working in Fort Erie, Niagara-on-the-Lake, Grimsby. So what are the priorities moving forward? And then we're going to aggregate this all together and submit it to the parliamentarians and all the political parties.
Are there questions about being better prepared for a future healthcare crisis such as COVID-19?
Absolutely. And the whole focus is where do you see we should be putting resources moving forward?
You mentioned seniors issues, and long-term care homes have been under the microscope for the last 15 months with all the deaths that happened early on in this pandemic. Where do you see some of the needs there, and what do you feel will be the calls for change from the public who answer these surveys?
Well, I really think this is a great opportunity. So we didn't anticipate the pandemic, but let's get prepared for the next pandemic. What can we do better? And what should the focus be? And I think there's room for improvement, and hopefully people will identify that. Hopefully the people of Niagara will see, yeah, that's the focus. That's where we need to focus moving forward. We need to do better based upon our current information.
How long would you estimate it takes the average person to get through this survey, Doctor?
Well, actually, I had my wife try it, and it took her about 3 minutes. So that means the average person could take about 2.5 minutes.
And are there questions that are specifically geared towards the region and specifically geared alternatively towards the province?
Well, the questions are basically the same right across the province, but we want to know them by the regions. So there's going to be an aggregate of Ontario, but it's also Niagara Region. So I'm chair of District 4. So I represent the doctors from Fort Erie, Niagara, right to Hamilton. So it's the whole region.
Dr. Tytus, thank you for joining us, and the website for this, and how do people find it?
Well, the website is betterhealthcare.ca. And my parting note is make sure you get a vaccine. And on a personal note, I can't wait until I get a haircut again.